Hello, everyone. My name is Dr. Ashok Agarwal, and I will be your host for the next 2.5 hours. And we are here to welcome you to the next online ART training in Module 5A, which is Overview of IVF and ICSI. Today is Tuesday, May 18, 2021. And this program is made possible by the American Center for Reproductive Medicine at Cleveland Clinic. Again, welcome to everyone. So here we go. This is my short biography. Um, for those who have not attended the previous program, I'm the Director of Andrology at Cleveland Clinic within the Department of Urology. I'm also the Director of Research and very much involved in research in the causes of male infertility. So our program is one of the most active programs looking at the research, focusing our research on causes of male infertility, looking at how we can find solutions that can benefit patients who have male factor infertility. The organizers and the speakers have no conflict of interest. No companies or outside entities were contacted for sponsorship of these events. This program was made entirely possible by the educational support by the American Center for Reproductive Medicine, and the webcasting was supported by David Reichling, David Wolfley from our Information Technology Division at Cleveland Clinic. Thank you to them. The course faculty who you will be hearing today have donated their time for this online training course. Program coordinators you will meet here have volunteered their time for this training. The names, images, and description of products and instruments that you may see in the lectures are used routinely in various laboratories, IVF labs, and these items are not endorsed by the speaker. So today's program, as you have seen, this is called Module 5A, which is basically an overview of in vitro fertilization and intracytoplasmic sperm injection. The program is supposed to complete by noon because it includes the part related to multiple choice. Our lecture component should finish within 2 hours. We have timed it. So the learning objectives today is talks related to essential equipment, supplies, and culture media, protocols for oocyte retrieval, oocyte denudation, and embryo transfer, oocyte characteristics and embryo quality assessment, and important parameters for embryo culture, monitoring, and quality control. In addition, we have 2 more lectures, one by Professor Hassan Salam and one by Kelly Athaije Virka. So these are the components of the today's program that you will see starting from in a circle, starting from equipment to oocyte retrieval, gamete quality, embryo culture, expert commentary, and then industry perspective, and a very brief conclusion. I want to introduce our first speaker, Dr. Christina Anagnostopoulou. I'm sorry if I'm not able to say this correctly. I always have problem pronouncing this name, the surname. She's a senior clinical embryologist at the ART unit in one of the centers in Athens, Greece. Christina is certified as a clinical embryologist from ASHRAE and has over 16 years of experience, very rich experience in IVF field. She has studied biology at the National University of Athens and was trained as a clinical embryologist in UK and Cleveland Clinic. She has been providing IVF training as a faculty at our center since 2011 as the chief training faculty. So welcome to Christina. She has recorded her presentation, although she's attending the program just to ensure that there is no internet-related problem. We have asked all the speakers to record their presentations. So they are all present, but we will listen to their recorded presentation, which was just recorded recently.
Hello everyone, my name is Christina Anagnostopoulou and this is a presentation about essential equipment, supplies and culture media in IVF. The learning objectives include not only the equipment, reagents and supplies needed, but also to familiarize with the workflow in the IVF lab, to review and compare different types of embryo culture media, and finally to understand why it is important to prepare properly the culture dishes. But first of all, let's have a tour in the IVF lab and see all the equipment that are used in there. For example, two large incubator for video calibration or for embryo culture. This is a laminar flow hood with a microscope. All manipulation takes place here. This is an ICSI machine, another big incubator, another microscope with micromanipulators. Here we can see another incubator with a time-lapse system for monitoring embryos during their development, desktop incubators, another laminar flow hood. We can see that there are more than one laminar flow hoods and more ICSI machines. So this depends on the number of cases and the number of embryologists. Also, we can observe that this is all the IVF lab, the sperm preparation lab and the cryopreservation room are in a different area. So this is a list of the basic equipment for an IVF lab, such as microscopes, incubators, workstations, air filtration equipment, but also cryopreservation supplies, such as the liquid nitrogen tanks to store the embryos at a very low temperature, heated surfaces to keep the temperature at 37 degrees, a centrifuge for sperm preparation, and finally the refrigerator for storing the culture media. On this slide, we can observe the three different microscopes used in an IVF lab, such as the dissecting microscope for all oocytes and embryo manipulations, the inverted microscope for ICSI and biopsy, and also for evaluation as it can provide high magnification, and finally the upright light microscope for semen analysis and sperm preparation. Here we can take a closer look on the inverted microscope. Of course, it comes together with the micromanipulation system. For example, this is an air microinjector responsible for controlling the flow of the media inside the ICSI and holding pipette. The incubators may be the most important piece of equipment because embryo culture takes place inside the incubator. The number of incubators is very important. For example, this is a big incubator. We can fit a lot of dishes inside this large incubator. However, every time we open the door, conditions change for all the culture dishes. So we should keep a restricted number of door openings to not overload the incubator, to maintain a stable temperature at 37 degrees, and to calibrate frequently with pH meter and gas analyzer. Finally, filters should be also changed frequently. So this is a type of quality control you can do in your lab to measure daily the CO2 in the incubator. CO2 measurement is an indirect way of measuring the pH, but it's very quick, so we can do it even daily. However, we need to do once in a while also the pH measurement, that is direct measurement, but it's more time consuming. If we need to classify the incubators, we can use the following criteria, such as humidity, gas phase, size, heat, and whether they are integrated in workstations. So we have the following options: humidified incubators or non-humidified. In case you are using dry incubators, you have to keep in mind that always the culture should be under mineral oil, otherwise the evaporation happens very quickly. There are two options of gas phase, the traditional one in older incubators that has only low CO2 in order to regulate the pH. But also there are other types of incubators that also provide low oxygen. This will benefit the culture to blastocyst stage. In this slide, we can see the difference between large and benchtop incubators. Large incubators have several advantages as they can be used to equilibrate large bottles of media, and they allow independent probes to be installed. They provide extra space. However, we have to remember that every time we open the door, the bigger the incubator, the slower were the recovery rate, so it takes more time to go back to the required conditions. On the other hand, benchtop incubators are less prone to variation in temperature and pH. We can see that in each chamber, only a few dishes can fit here. So actually this is an advantage because the temperature and CO2 concentration of each chamber is regulated independently. So whenever we open the door, the rest of the dishes are not affected. And this is another type of incubator together with a time-lapse system to monitor the embryos all the time. It can provide uninterrupted culture. We don't need a workstation or inverted microscope to do the assessment. We can do the assessment from the screen here or from the PC. So the workstations is where all the manipulations take place. It's used for oocyte collection, denudation, and embryo transfer. It provides control environment for all IVF procedures. All workstations will maintain the temperature at 37 degrees. Some will maintain also the pH because they provide a supply of CO2, and some also provide aseptic conditions, such as the biological safety cabinet. It provides sterile conditions by sterilization of the air, either by UV heat or passes through a filter that removes the larger particles. If you want to choose between the different biological safety cabinets, keep in mind that the most recommended for an IVF lab is the Class 2 that provides personal environment and product protection. However, there is an alternative to the biological safety cabinet. It's called modified neonatal incubator. It maintains not only temperature but also pH and humidity because it has a CO2 supply, and it can be adapted also to hypoxic conditions. So in case that you are using bicarbonate buffered media, you can use it without any change in pH thanks to the supply of CO2. According to the Cairo Consensus on the IVF lab environment and air quality, many studies indicate that by controlling laboratory contamination, we can positively impact IVF outcomes. So we should take great effort to ensure that the lab has clean air, and we should have some air filtration system to improve laboratory key performance indicators. Not only the particles from outside the lab, but also volatile organic compounds will significantly affect cleavage, embryo development, and blastocyst formation rates. So the VOCs come from sources from materials that we are using in the lab, such as cleaning chemicals, printers, and plastic packages. So that means that the office should stay outside of the lab. Also, we should store our dishes and whatever comes in a plastic package outside of the lab. Another way to eliminate the particles and VOCs and also criteria air contaminants is the use of the heating, ventilation, and air conditioning system. In order to have a clean room in the lab, we should have positive air pressure. That means that the pressure inside the lab should be higher than that of the adjacent rooms. There should be parallel streams of air that blow across the room, and the use of filters, HEPA filters, and filters that remove organic compound. Another choice, another alternative are the mobile air purification devices that also use carbon and HEPA filters and also reduce particles, VOCs, and criteria air contaminants. However, we have to keep in mind that they have limited capacity, so they are effective up to a specific surface. Those are the supplies and reagents needed in the IVF, such as plasticwares, cryopreservation supplies, needles, catheters, and of course the culture media. According to the ACRM guidelines for good practice in the IVF lab, all consumables used should be embryo culture grade, CE marked with appropriate quality control. They should be disposable, stored appropriately, and we should have an appropriate stock management system to track them. For example, you can draw a table like this and track all the items you are using, their batch number and expiry date. Those are some types of plastics, such as serological pipettes, Petri dishes, and this is Pasteur pipette for oocyte handling during oocyte retrieval. And those are some cryopreservation supplies, such as canes, markers, straws, syringes, timers, and storage tank. And in this slide, we can see some vitrification supplies, such as the solutions, multiple vitrification devices, tanks, and temperature sensors. The choice of the oocyte retrieval needles and the embryo transfer catheters relies on the clinician. So there are single and double lumen needles of different sizes. Also, there are soft or rigid catheters of different lengths, and of course, we can use a stylet in case that the embryo transfer is difficult. One of the first culture media system used is the sequential media that was designed based on the changing metabolic needs of the human embryo. It is considered to be more physiological because it is based on the different concentrations of nutrients in the different developmental stages. It contains more than one media formulations, and we need to transfer our zygotes between day 0 and day 1 to cleavage medium, and then transfer to a new type of medium between day 3 and day 4 that is usually called blastocyst medium. Those are the compositions, the ingredients of the three types of culture media formulations: fertilization medium, cleavage, and blastocyst medium. So we can see that there are several differences. For example, there is lower glucose in cleavage medium, and there is no EDTA in blastocyst medium because it has been found to be detrimental for the formation of the inner cell mass. There is another type of culture media. It is called single-step medium. It was designed later, and it has lower concentrations of all the nutrients, and it is supposed to let the embryo choose whatever it needs to use at a specific time. So it provides simplified lab protocols, lower costs, and it is ideal for time-lapse systems. So all we need to do is to transfer to single medium between day 0 and day 1 and keep the embryos at the same dish throughout all the culture from day 0 to day 5. However, there are some considerations because we are keeping the embryos in the same dish for 5 days. There might be accumulation of VOCs, and also because of evaporation, we can have increased osmolality. To avoid this, we can have interrupted culture in a single medium. So again, we have only one type of media, but we transfer to a fresh new dish of single-step medium between day 3 and 4. It is not only the type of culture media system we are using, but also the way that we are preparing the culture dish that is important. So we always do culture dish preparation under the laminar flow hood to maintain sterility. We have to do this on a cold surface to avoid evaporation. Of course, we do this procedure the day before we are going to use the dish. In order to equilibrate in an incubator with CO2 and make sure that the pH is regulated and the temperature is at 37 whenever we want to use the dish. We make small droplets of medium under oil. So we do this in 2 steps. First, we set a very small amount of media in order to make the droplet, make a trace of the droplet. Then we add liquid paraffin oil, and then again we fill up with more media. So the liquid paraffin is very important in order to act as a physical barrier that protects our culture media. Also, it prevents the sudden change of conditions of temperature drop and of pH change whenever we take this out of the incubator. Here we can see that we add more media in each droplet. So by doing this procedure in 2 steps, we ensure that there is less evaporation of media during the culture dish preparation. This is another type of dish used for the time-lapse incubator. It consists of 2 different chambers. Each chamber has 8 microwells for 8 embryos, and also 4 bigger wells for embryo washing. And now my colleague is adding some small amount of media in each one of the microwells. And then as a second step, she will add the rest of the media, that is 200 microliters. So now filling up with 200 microliters of culture media. We are doing this in 2 different steps, so we make sure that all the microwells have media and that there are no droplets of air trapped that may prevent the media from getting equilibrated. And then repeating this for the second chamber, and then adding media to the bigger wells that are used for embryo washing. No matter what type of dish you have, always you need some droplets for washing. Then we will add some liquid paraffin. This takes up to 1.5 ml of mineral oil. And then the last step is to add this dish to the incubator or the time-lapse incubator for equilibration from 18 hours to 24 hours. So let's see some scenarios. First scenario is that there are signs of contamination present in more than one IVF case. So what would you do? Some suggestions is to prepare the dishes always under the laminar flow hood, to check the sterility of all the supplies, such as pipettes, tips, and dishes, to check the media expiration date, to reduce the quantity of dishes, because if we prepare many dishes at the same time, many accidents may happen. We can desterilize a pipette and use it again, and then contamination can arise. And of course, to revise the sperm preparation procedures. If it's not done properly, you may have contamination. Another scenario, you're opening a new IVF lab with small numbers of cases. So how many incubators are needed? You cannot have just one incubator, because if you are culturing the embryos in one incubator, you cannot add media for equilibration that are maybe cold, and you will open the door for a long time. So I would choose at least 2 incubators, one large for media equilibration and one probably desktop for embryo culture. Scenario number 3, a new time-lapse system incubator is purchased. Which type of culture media would you use? So in case you are using the time-lapse system and the single-step media, this allows you to do uninterrupted culture. You don't need to take the embryos out for observation, any manipulation, and not for changing the droplets. However, in case you want to use sequential media, because you think it provides you better results, you can use it, but however, you have to prepare a new dish and change the embryos, move the embryos to the new dish between day 3 and 4. Finally, scenario number 4, although there are many good quality embryos on day 3, blastocyst formation rate remains low. So what action should you take? Some suggestions is to consider switching to reduced oxygen tension in case you're not already doing this, to minimize the door opening by adding more incubators, To check the embryo culture density, in case you have more than one embryos in one droplet, you should increase the volume of the droplets. And finally, if you're using single-step medium, you can consider changing the tissue on day 3. To conclude, calibration, repair, maintenance, and quality control is very important for maintaining ideal culture conditions. Also, the use of fair filtration equipment is necessary, and it benefits embryo development and implantation. How to choose the most adequate culture media system will depend on how your own IVF lab is set up and what type of incubators you're using. And finally, the proper preparation of tissues is necessary to create a microenvironment that is ideal for embryo development. Thank you for your attention.
And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ACRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.